Sequence for putting on PPE is as follows. Perform hand hygiene, put on your gown, put on your P2 or N95 respirator mask, fit check your mask, put on your protective eyewear. Refit check your mask, put on your gloves, stop and check that everything is in place. Now watch as we demonstrate these steps in detail. Before putting on any personal protective equipment, it is essential that you perform routine hand hygiene. This is considered to be the most important infection control measure in preventing the spread of infection and should be performed before and after contact with patients and their immediate environment. The use of gloves does not remove the necessity for hand hygiene. Effective hand hygiene can be performed by either washing with soap and water or an alcohol-based hand hygiene product when hands are not visibly soiled. Hand hygiene protects you and the people to whom you provide care. Protective gowns will prevent your clothes from being contaminated. The gown should be impervious, long-sleeved with fitted cuffs and be able to effectively cover your clothing. Put your gown on one sleeve at a time. Tie off at the neck. Now wrap the gown around your back, ensuring all clothing is covered. Tie off the gown securely so that it will not come undone whilst in use. Prior to putting on a P2 or N95 mask, check the mask for visible damage such as tears or holes in the filter material. If there is, discard and select a new mask. When using a flat fold mask, identify the top of the mask. This usually has a flexible bridge. Open the mask to form a round shape. Gently loosen and separate the straps before putting on the mask. Leaning slightly forward, push your chin out and bring the mask up to your face. Place the bottom section of the mask under your chin. Then lift the straps over your head. Make sure that the top strap is at the crown of your head and that the bottom strap is just below your ears. Check that the mask is covering your face from under the chin to the bridge of your nose. Ensure the mask is not too high on the bridge of your nose, otherwise it could interfere with the wearing of protective eyewear. Using your fingers, mold the mask around your nose and cheekbones, making sure the edges are well sealed and fitted against your face. At times, there can be a remaining gap near the bridge of the nose. To remove this gap, stretch your nose by dropping your jaw and pinch the mask around the bridge of your nose. Once this technique is used, the gap is sealed. When fitting your mask, it may be helpful to have a mirror nearby so you can visually check the placement on your face. Every time you put a mask on, you must perform a fit check. This is your way of ensuring your mask is correctly sealed around your face. If the mask is not correctly fitted, there is a potential for exposure to infectious airborne particles. To perform a fit check, take a deep breath in and breathe out. If the mask collapses when you inhale and puffs out when you exhale, and you don't feel any large leaks of air around the edges of the mask, your mask is considered to have passed the fit check. If your mask does not puff out or collapse, or you feel significant air leaking around the edge of the mask, your mask has failed the fit check. You should then check the seals around the bridge of the nose are secure and firm, that the mask isn't crooked, or that it's not bunched or folded under the chin. Once you have done this, refit check the mask. Protective eyewear shields your eyes from direct contact with respiratory droplets and accidental contact from contaminated hands. If you wear prescription eyewear, Put these on prior to the protective eyewear. Whenever putting on any type of eyewear, it is good practice to use the arms of the frame. This keeps your hands away from your eyes and reinforces safe practice for removal. Make sure your protective eyewear is sitting securely and is not affecting the fit of the mask. You should refit check your mask to ensure that this is not changed during the application of your eyewear. Wearing disposable protective gloves reduces the potential for skin contamination. Fit the first glove on your hand. Then pull the end of the glove over the cuff of your gown. This will make a tight seal, reducing the potential for contamination of the wrists and forearms. Repeat this for the second glove. You may initially experience difficulty doing this, but with practice it will become easier. Remember, it is important that you do not adjust your mask or protective eyewear or touch your face whilst in the containment area. For this reason, you should stop, take time and check that everything is in place and you're feeling reasonably comfortable. When it comes time to remove all your personal protective equipment, it is important that you continue to be mindful of the task you're about to undertake. Your PPE may have been contaminated with respiratory droplets and infectious airborne particles, and this is the most likely time when you could accidentally infect yourself. The key principles are: have a consistent sequence so that this can become routine. Take your time, don't rush. Minimize contact with contaminated surfaces of your PPE. Always perform hand hygiene prior to removing any PPE from your face. Remove the first glove by holding the cuff and rolling it down. Twist your hand gently around as you roll it from your hand and into the palm of your gloved hand. Remove the second glove by placing your fingers under the glove and rolling it from your hand and over the first glove cradled in your palm, disposing of the two gloves together. You must now perform hand hygiene. Using alcohol-based hand rubs, remember to allow the product to dry completely. Using both hands, remove your protective eyewear by holding the arms of the frame only. Your gown has a large surface area of potential contamination. Therefore, you must take care and remove it in a controlled manner. Starting at the top, undo the ties. If you're having difficulty doing this, seek assistance, or if the gown is disposable, carefully tear the ties. Once all ties are undone, take hold of the top inside surface of the gown. Leaning forward, start to remove the gown by pulling it out and away from you. As you remove it, fold it over so that the contaminated surface is on the inside. Continue doing this until the gown is a small folded parcel. Place the disposable gown immediately in the waste container. After removing your gown and before you remove your mask, it is essential that you perform hand hygiene, as you will be bringing your hands up to your face. When removing your mask, remember these principles. Avoid touching the surface of the mask. Use the straps. Remove in a downward direction away from your face. Slip your fingers under the straps just in front of your ears, being careful not to touch the front of the mask. Slide fingers under and around to the back of your head, drawing the straps together. Lean forward and slowly lift the straps over your head, pulling the mask down and away from the face. Continue to hold the mask by the straps and drop into the waste container. Disposable masks cannot be safely reused, as this poses the risk of direct contact with contaminated surfaces and possible infection. After removing your mask, you must once again perform hand hygiene. You may use an alcohol-based hand hygiene product or perform a routine hand wash.